Good afternoon. I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. Another reminder, please take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate as shown here. The link has been placed in the Viber group and also in the Facebook group, as well as in the chat box by Abet. Another reminder, obtaining 50 OLETE certificates will entitle one to a free voucher for an ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum while we are having some question and answers and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay, ready? Ready? Okay. 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. These are the contents of the core course. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled CPR and AED Awareness. CPR stands for Cardiopulmonary Resuscitation and AED stands for Automated External Defibrillator. This is in consonance with the DOH, Department of Health, Health Awareness Calendar, in which they declared July 15 as the National CPR Day. So the empowerment objective is for the lay people to have an essential understanding of CPR and the use of automated external defibrillator in their health management. The contents of this particular pep talk will be what is National CPR Day in the Philippines, what is CPR, what is the importance of CPR and AED in our daily life, what is an AED and how to use it, what is the importance of having training in CPR in our daily life, and how to do the CPR. So a disclaimer, this ROJoson pep talk contains my thoughts, perceptions, opinions, and recommendations culled from experiences of other professionals and my own. So let's start with the first topic. As I said, CPR stands for Cardiopulmonary Resuscitation. And what is CPR, National CPR Day in the Philippines? It's being celebrated every 17th day of July, following this Republic Act number 10871, otherwise known as the Samboy Lim Law. This law was created in honor of Samboy Lim. As we know, he's a basketball player who suffered a cardiac arrest during warm-up sessions before a game. But Samboy recovered after being comatose for some weeks and still alive as of today, 2023. What is CPR? It's an emergency procedure that can help save a person's life if their heart stops. Okay? Pag huminto yung puso nila, you can institute a CPR right away. The heart that suddenly stopped. Okay? Cardiac arrest is when a person starts heart stops beating. So we say may cardiac arrest isang tao kung yung puso niya ay hindi na tumitibok. And sudden cardiac arrest is when the person's heart suddenly, yung biglaan na lang, huminto yung pagtibok ng puso. Sudden. So sudden cardiac arrest. During the cardiac arrest, the heart cannot pump blood to the rest of the body, so including the brain and the lungs. So that can happen in minutes without treatment or CPR. Kaya importante yung timing. CPR uses chest compressions, yung dinidiin ng dibdib as illustrated here, to mimic how the heart pumps. So pag dinidiin, parang pinapump yung heart mo para yung mga dugo pupunta sa brain at sa lungs and other parts of the body. So these compressions help keep the blood flowing throughout the body until medical professionals arrive. So this is assuming that you are lay people doing the CPR. So you do it until some expert in continuing the resuscitation will take over. Cardiac arrest is not the same as heart attack. So remember that. Kasi kadalasan na interchange between the two, heart attack, cardiac arrest. A heart attack happens when the blood flow to the heart is blocked. Kasi sa heart may mga blood vessels. Kung may naka-block doon yung mga blood vessels, you can have chest pain, sometimes wala pa nga, and then magkakaroon siya ng heart attack, which eventually might lead also to cardiac arrest. No? Sa umpisa, meron siyang mahina tibok ng puso because of the compromised blood flow. But eventually, the endpoint will be the same, cardiac arrest, kung hindi maagapan. A person having a heart attack is still talking and breathing. Pwede pa. Yung sudden cardiac arrest, wala na, biglaan na lang yon. So this person having a heart attack does not need CPR. So kung may heart attack, hindi pa kailangan ng CPR. Pero pag nag-cardiac arrest na, then you need the CPR. Okay. So heart attack increases the risk for going into cardiac arrest. Yung sinabi ko, may heart attack muna, then eventually it can go into cardiac arrest kung di maagapan. No? Or kung minsan wala namang heart attack, sudden cardiac arrest lang. No? So let me emphasize, cardiac arrest is not the same as heart attack. What is the importance of doing CPR in our daily life? Sudden cardiac arrest or heart arrest can occur anytime in the body, just like any disease can develop anytime in our body. So it can occur in you and me, tayo, our loved ones, and our neighbors. So when someone goes into sudden cardiac arrest, every second counts. Yung timing are very, very important. Okay? A cardiopulmonary resuscitation has to be done right away. In terms of seconds, ito, right away. Otherwise, the person with cardiac arrest will die. And if he recovers, kung naka-recover siya, pero natagalan yung CPR, he will have brain death. Okay, kung di, as I said, kung di naagapan kagad, magkakaroon siya ng brain death, baka maging vegetables na lang siya, buhay siya, pero vegetables siya. Okay? So this is important to do CPR right away after diagnosis of sudden cardiac arrest. So importante yung timing, quick. Okay. What is the everyday someone near you may need your help at any moment because di natin alam kung kailan tatamaan ng cardiac arrest yung isang tao, kamag-anak natin, kaibigan, kakilala, neighbor, okay? Knowing CPR and how to use an AED could save your life. Or put it in an even more personal perspective, someone next to you knowing these skills may save yours. Kung ikaw inatake, naturuan mo yung isa at marunong mag-CPR, that particular person can save your life. So the more people who get training in the CPR, the more lives that may be saved. So yan ang advocacy rito. Lahat ng tao ay dapat marunong gumawa ng CPR para magtulungan at baka matulungan ng sarili natin. Okay? So this is a picture of the automated external defibrillator which you see oftentimes in all the establishments nowadays. So it is said that a patient's chance of surviving a sudden cardiac arrest dropped by 7 to 10% for every minute a normal heartbeat is not restored. Kaya importante yung timing. Dapat mabilis. Using an AED with CPR can help save someone whose heart has stopped. Ito, complementary AED to the CPR. In the malls, in the hospitals, or practically all establishments nowadays, we often see AEDs posted on the walls of the hallways. So nakikita natin pero mukhang hindi natin alam kung anong gagawin doon. So it is nice to learn how these are being used also. What is an AED? An AED is a battery-operated portable medical device that is commonly placed in increasing number of work and public places. It comes with a pair of electrode pads that are placed on the chest sa dibdib. Once connected, the AED uses computerized algorithms to determine if there is a condition known as ventricular fibrillation that requires an electric shock, also known as defibrillation. Kaya tinawag na defibrillator. So in simplest term, the AED helps shock the heart rhythm back to normal. So computerized ito, siyang magsasabi sa atin kung kailangan maggamit nito. Okay? Basta i-on lang yung AED at bibigyan na tayo ng signal. It's simple to operate once it's turned on because there are some visual and verbal prompts that will guide you step by step. So example, ito. So place the set of adhesive pads, may kasamang adhesive pads dun sa device, okay, on the unconscious patient's individual's bare chest. Dito, dalawa, pad, upper part and the lower part. Okay. Stand back, magdidikit dun sa pasyente as the AED analyzes the individual's heart rhythm. So, yung mga rhythm, kung mga pangit ang rhythm na walang pattern, basta taas, baba, ganon, no? So, that means baka merong ventricular fibrillation is going on. But the AED will tell you whether it can be used or not. So if it says that you have to use it, then you press the shock button. There's a shock button here. Okay. When prompted by the AED. Pag hindi niya sinabing press, don't press it. Okay. And then when you press it, make sure that you are far away from the patient. Baka makuryente tayo. Okay. So follow the prompts on the AED to check the individual's breathing and start the CPR. So kailangan pa rin nag-CPR, hindi lang AED. As I said, AED is complementary. No? Okay? So importante, malayo sa pasyente when you press on it, and you press it only when you are given the signal by the AED. So madali lang gawin ito. So at least may idea na tayo. Kasi madalas tayo nakakita ng AED sa mga mall, sa mga hospitals, establishment. Ano kaya ito? No? Okay. So next time, baka magamit ninyo. Okay. So a few things to remember when using the AED. A conscious person who is having a heart attack, not sudden cardiac arrest, does not need an AED. Tandaan natin to, ha? Conscious pa yung pasyente, heart attack lang, hindi kailangan ng AED. Make sure that the area around the person is clear. Okay, didikit, walang didikit. Okay. Touching the person could interfere with the AED readings of the person's heart. Okay. Aside from the makukuryente kayo, yung mag-interfere dun sa reading. Okay. Not all cardiac arrests are due to ventricular fibrillation. Kaya yung AED magsasabi sa atin kung meron siyang ventricular fibrillation. And the AED will not deliver an electric shock if the heart rate is not shockable rhythm. Okay. Every day, to re-emphasize, every day someone near you may need your help at any moment. Knowing CPR could save their lives, and or put it in an even more personal perspective, just think of yourself, someone next to you knowing these skills may save your own life. So the more people who get training in CPR, the more lives that may be saved. In the National CPR Day, July 17, and I'm supporting this through my pep talk. I am encouraging everybody to learn CPR and AED. And the more people who get the training in CPR and AED, the more lives that may be saved. These lives may be yours, if not your loved ones. And you don't have to be a healthcare, you don't have to be a doctor, okay, or a nurse, okay, to be a responder to save their life using CPR and AED. So I'd like to empower you, a layperson, and I hope you will agree to be empowered by me in doing CPR and AED. How to do the CPR? First, there must be a diagnosis of sudden cardiac arrest or sudden cardiopulmonary arrest in the heart attack. Okay? Cardiac arrest or heart arrest. Okay? Sudden cardiac arrest is a condition in which the heart suddenly stops beating for whatever cause. Huminto na lang. Na? Okay. So the first sign of sudden cardiac arrest is a sudden loss of consciousness. Mawalang malay ang tao. Then upon checking the pulse, either on the wrist or on the neck, sa kamay or sa leg, no pulse can be detected. These two signs are sufficient basis for the diagnosis of sudden cardiac arrest. Additional sign will be the stopping of breathing. Hindi siya humihinga. Kung meron itong pangatlo, all the more you really have to do the CPR. Okay? So sudden loss of consciousness, okay, no pulse, no breathing. Okay, ito, okay. So loss of consciousness, no pulse. Okay, so check on the wrist sa base on the thumb, the wrist. Ang pinakamadali dito sa neck. Okay, kung merong pulse o wala. Okay. There are two types of CPR techniques. One is hands only, chest compressions only, and the other one is the traditional CPR with breathing with mouth-to-mouth resuscitation, also called the CPR with breath, or we call this mouth-to-mouth resuscitation with chest compression. Alternate yung chest compression with mouth-to-mouth breathing or resuscitation. So two types of CPR techniques, chest compression only, so the hands on, and the chest compressions with mouth-to-mouth breath or resuscitation. Hands-only CPR is easier and is appropriate for adults and teens, yung mga teenagers in cardiac arrest. It should be learned by everybody. Kasi medyo madali na. The traditional CPR is more difficult and is appropriate for anyone in cardiac arrest, including adults, teens, children, and infants. Okay. So the CPR can be complemented by the AED. So this is added to the CPR when it is available. So usually pag sa bahay, wala. Pero pag sa mga sa malls, usually andun na yung mga public places. So CPR, kahit na may AED, you must still do CPR. Okay. So AED is added only when there is ventricular fibrillation. So remember that. Ha? Baka umasa tayo palagi sa AED, machine kasi, maganda. Okay. So we still need to do CPR. We must know how to do the CPR. So the emergency life-saving actions include, number one, okay, clearing the airway, repeated chest compressions, and repeated mouth-to-mouth breathing if you're going to use the CPR with mouth breath. Okay, but this is only after you recognize that there is sudden cardiac arrest, and then ensure that the area is clear, walang safe to handle the patient, and then you ask somebody to call 911, 143, 117, kung ano mang hotlines that you know of, no, that with ambulance, and then be ready to institute the CPR ready. So the CPR basically includes all these things that I mentioned earlier. You clear the airway, kasi pag barado yung airway, hindi siya makakahinga, yung pasyente hindi makakahinga. Okay, sayang lang yung mga resuscitation. Then repeated chest compression is pumping the heart, and then repeated mouth-to-mouth breathing just to give oxygen to the patient. Okay. So there's a note here that there's a version of CPR that does not require mouth-to-mouth resuscitation, chest compression only. So hindi recently lang ito, hindi matagal pa, no, that pwede na yung chest compression. It used to be the traditional one, medyo mas mahirap yon, no? So this is an illustration of how to clear the upper airway to ensure patency. So itataas lang yung chin and pasok yung kamay and make sure walang nagbabara sa bibig, no? Then chest compression only, CPR. So put your two hands here in this position, interlocking each other, then push down hard and fast in the center of the chest at the rate of 100 to 120 pushes per minute. You can count or tuloy-tuloy lang kasi mahirap na mag-count ng 220, no? So tuloy-tuloy lang, okay? And then when you push down, when you compress, make sure that you push down hard by about 2 inches. 2 inches. Just imagine yung depth, 2 inches. And then after you push down to 2 inches, just let the chest bounce back to its normal position, which it's pushed, then repeat. Okay. So to repeat the positioning on the center of the chest with interlocking hands, and then make sure that your elbows are straightened, wag yung baluktot, no? Okay, then the weight of your whole upper trunk is down on the hands, and then press hard about 2 inches, and then release it, no? And then repeat it again and again up to 100 to 120 pushes per minute. So note, chest compressions are performed with 2 hands for adults. Malaki kasi ang tao. Okay? Sa bata, pwedeng 1 hand. And then sa mga maliliit na baby, infant, pwedeng yung thumb lang or fingers. Pwede na yun. Now, this is the traditional one. So chest compression with mouth-to-mouth breathing. So this is in the conventional CPR. You breathe in, you put in 30 chest compressions and then 2 rescue breaths. So 1, 2, 3, 4, up to 30, and then mouth-to-mouth resuscitation, then back to chest compression. Okay. Yeah. So the emergency life-saving procedures actions are done until the person in the cardiopulmonary arrest has been revived or has started breathing on its own and or are called off because of a judgment of a non-reversal already. So tuloy-tuloy lang until there's a decision to call it off. Okay. Number 1, baka may nagsabi may mga doktor na dumating, okay, bystander, no? Naka 30 minutes ka na, pump, pero wala rin nangyari, baka mag-call off na, wala na magagawa. No? Okay. So let me show you some video, okay, to illustrate how to do the CPR. Okay.
A cardiac emergency can happen anywhere. Be prepared with a simple technique known as compression-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. If someone suddenly collapses, check to see for safety. Then, check to see if the person responds to you using the shout, tap, shout technique. At the same time, check for breathing, life-threatening bleeding, or another life-threatening condition. Are you okay? Are you okay? If at any time you determine the person is experiencing a life-threatening emergency, call 911 and give the first aid kit and AED or telephone 150. Anna, call 911 and give the first aid kit and AED. Then, if they are unresponsive and not breathing or only gasping, begin compression-only CPR. Ensure that the person is on their back on a firm, flat surface, touching the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hips. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compression. In giving compression, push hard and fast. Compress the chest to a depth of at least 2 inches at a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. Finally, keep going. Continue giving compressions until you notice an obvious sign of life like breathing. An AED is ready. A trained responder is available to take over compression. EMS personnel arrive and begin their care of the person. You are alone and too tired to continue, or the scene becomes unsafe. A cardiac emergency can
Another one.
almost collapse. The scene is safe. He appears unresponsive. I don't see any life-threatening bleeding. Sir, can you hear me? Sir, no way. Unresponsive and not breathing. Call 911, go get the AED and the first aid kit. I'll call 911, get the AED and first aid kit. The AED and first aid kit, EMS is on the way. I'll go wait for them. I can't certainly to purpose their chest to show. What is the answer? Don't touch person. Analyze it. Clear. Don't get by. Red flashing shock button. Clear. Shock delivered. Start CPR. Almost collapsed.
So after the video, I've shown you CPR only and also CPR with mouth-to-mouth resuscitation and with the use of the AED. So as a summary and takeaway, what is I've presented these topics. What is National CPR Day in the Philippines? What is CPR? What is the importance of CPR and AED in our daily life? And what is an AED and how to use it? What is the importance of having training in CPR in daily life? And how to do CPR. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on CPR and AED. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on the use of CPR and AED in sudden cardiac arrest. This ends my pep talk. I hope I have empowered you to have an essential understanding of cardiopulmonary resuscitation and the use of automated external defibrillator in your health management. Before we go to the question and answer portion, let me remind everybody to take the OLETE and get a certificate like this. And then 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultation. And then feedback, please type in your feedback in the chat box while the pep talk during the open forum. And let's now have a group picture taking before we start the question and answer and interaction. Please show your faces now. Okay. 1, ready? 1, 2. Okay. We still have 4 minutes before this Zoom will end automatically, but we can reboot it. Any questions? Any questions? Do you agree that it's easier to do the CPR nowadays? Just press on the chest. Tama na, no? Kung ano. Okay, kung minsan ayaw din natin mag-mouth to mouth kasi baka mag-infect o kaya ano tayo, di ba? Okay. I've done a mouth-to-mouth resuscitation when I was in 1976. No? May nalunod isang pasyente sa probinsya. No? So kahit na may TB siya, buti ito lang, di ako tinamaan ng TB. So I did a mouth-to-mouth resuscitation of that patient. No? So in the province, wala pa yung mga plastic na airway, artificial na pwedeng gamitin. So diretso na mouth-to-mouth. No? Okay. Okay. Any questions? How many have done CPR before? Wala. Okay. Can you share your experience, Maria? Gusta? Kaninong ginawa? Unmute yourself. Hindi mo ma-unmute? Unmute? Unmute?
Sorry po. Apo, okay. Kasi ho sa school, required kami every 2 years kumuha ng Red Cross training.
Okay, Red Cross.
BLS. Oo, BLS AR tsaka CPR. So, and then sa dad ko ho, I did it CPR kasi na siya, he was he stopped breathing na, but he was very sick already, and then he suffered, I guess, the cardiac arrest na ho. But wala rin because when after the chest compressions, bumabalik na ho yung air when I did the mouth to mouth. Kasi yun, head tilt chin lift. So yeah. Wala na, it was bouncing back. Tapos I did it several times pero wala na ho.
Okay.
Kasi tsaka noon ho, it was still the old the old counting, 14 to 2. Tapos 4 na cycle. Tapos ang bilang namin 1,002, 1,003, 1,004. Nakakapagod po talaga.
Okay.
It's really tiring. At saka ano ho, kasi ngayon ho yung sabi niyo nga 30 compressions to 2 breaths. Kasi tina-time ho yan eh. It should yung 30 to 2, 5 cycles ho. And in 2 minutes dapat magawa mo. Yung 5 cycles, kaya you can imagine ho. Kaya ang bilang ngayon wala nang 1,002. It's 1, 2, 3, 4, 5. So you have to do it in a span of 2 minutes. Otherwise ho, it will not be effective. That was what the trainers told us. So after that, kailangan ho meron kang karelyebo kasi nakakapagod ho talaga eh yung mag-ano tsaka talagang mauubusan kayo ng hininga. Yun ho. So yun. And the dummy is hard.
Yung dami.
Matigas si dummy. Matigas ho si dummy. Matigas ho talaga.
Matigas na.
Oo. Antigas ho. Nakakapagod.
Okay, but you were able to use it on your father. That's good, no? Okay.
Yes. Oo. Pero ano eh.
So one
he was
reason
very-
hihinto ka, kung pagod na ka na, wala kang magagawa, di ba?
Wala na ho. Wala na. Oo. Wala na talaga.
And then the other thing that I like to emphasize, yung gagawin mo lang, yung you want to what do you call that? To revive, to resuscitate the patient. Kung talagang you have decided na wala na, huwag na, no? Just let the person die in peace na lang.
Oo. Kasi you will do more harm ho, di ba, than good. So,
Can we reboot? Mawawala na in less than 1 minute itong ano. Just check in again, no? Kasi I hope we can demonstrate you. So let's try to demo a little bit, no? Those who have a pillow, you just use the pillow na lang, no? Kung may pillow kayo in front of you, and then just demo the yung arm lang, no? Tingnan ko lang ha, kung pwede. I will change my virtual background. Kita ba? Now, can we try to simulate? Just use a pillow, and then yung kamay interlock. Then lagay mo sa pillow na lang. Just assume that's the chest of the patient, no? And then when you press on it, tulak, baba. Dapat perpendicular yung elbow. Naka-straight. 1, ganon, na? 2, 3. Sige, subok. Can you try it on your at your end? Try it at your end. Subok lang. Basta importante naka-straight yung elbow. Okay. Patingin yung mga pictures niyo para ma-document lang natin that we have this training session through the Zoom. Thank you, Mary, for joining us. Sige nga, demo mo nga, Mary. Yan, straight, Mary. Good. Good. Okay. Okay. So may timing yan, pero just try your best, no? Basta importante, at least may ginagawa ka to help, no? Okay. That's good. So ladies, kaya mo na? Dapat yung, yung straight yung kamay. Yung weight ng katawan, babaksak dun sa kamay mismo, not on the elbow. No? Yan, good. No? Okay. Okay, rally na. Kaya, sige. Very good. Sino pa? Okay, si Per. Yan, good. Sige. Straight yung elbow. Straight yung elbow, Pearl. Very good. Sino pa? Demo, si Lorly. How about the others?
Okay, I have a question.
Sure.
2 inches is medyo malalim, right?
2 inches? Yeah. Pero,
So kaya ba talaga? At saka, you really have to push really, really hard.
yeah. Talaga. Kasi yung ribs mismo matigas na eh. Kaya you really have to push hard inside. Na? Down. Na? 2
2
inches.
inches. But you won't break the bone.
Kumisan,
No naman.
yes, pero usually hindi. Usually hindi. Pliable naman yan eh. Na? Okay.
Okay. Yes, thank you, Doc.
So, just remember, basta madiin, push hard and fast. Di ba? Hard lang. Hard na lang muna. Sige. Kasi masakit na yun.
Yeah.
Okay.
Okay, thank
Kasi
you, Doc.
pag di madiin, then hindi mo mako-compress yung puso. Sayang lang. Na? So, dapat makompress yung puso. No? Okay. Okay. So, any more? So, any questions? I hope all of us present here will know how to use the CPR, the chest compression CPR. Okay. And you can also teach your relatives on how to do it. No? Madali lang naman. No? Okay. Madali naman tandaan kahit na wala kayong training, basta tandaan, basta pag nag-sudden cardiac arrest, ano na lang nyo, i-chest compression ninyo. No? Okay. Wag na kayo mag-isip na, hindi ko sasabihin, hindi ko alam how to do it. No? Basta gawin na lang ninyo. No? Best effort na lang. No? Okay? Any question? Pearl?
Doktor, saan ba? Dito sa gitna o dito sa taas ng puso? Dito sa gitna ng dibdib?
Doon sa malap...
Saan ba? Dito ba? Dito?
Yeah, dyan. Pwede
dito, sa gitna.
Sa gitna, pero sa baba. Yan, sa baba.
Dito.
Gitna. Okay? Okay. Kaya bababa yan Mary, bababa yan sa baba. Na? It will go down once you press it. Kaysa press mo sa itaas, mas matigas yun, di ba?
Dito.
Sa baba.
May I interject ho?
Yun, sure.
Dr. Joson.
Sure.
Pag when you look for where you're going to place your hands, kakapain niyo yung rib. Kakapain niyo yung rib, susundan niyo. Tapos kasi umaakyat yung rib Kung saan yung doon na malaramdaman niyo yung where it stops, doon niyo ilalagay yung kamay ninyo. So you swipe from where you're kneeling. So on the side, you swipe, ramdaman niyo yung kanyang rib, aakyat, you follow with your hand, then you put your right where it stops, tapos your left, interlock, tapos nakalock din yung elbows, and then you start. Pero you have to start with 2 breaths if you're going to use with the breath.
The mouth, yeah.
Oo, if you're going to use that kailangan you start with that. You start with 2 breaths before you do the compression.
Okay.
Ngayon, kung puro compression, okay lang.
Yeah.
Wala
Yeah.
na ng compression.
Sige. Kaya yan ang tinuturo ko na lang, pinaka-simple na chest compression. Na? Okay.
Chest compression.
So in the relation to, thank you for the input, Maria Pusta. You trace yung ribs mo, matitrace mo from below, di ba? I-trace mo upwards hanggang gitna, then doon mo ilagay. Na? Madali. Na? Okay. If you, baka kasi hindi natin alam yung anatomy na? Of the chest. So one tip is you trace the ribs sa baba na paakyat hanggang sa gitna, doon mo ilagay. Na? Okay. Okay. Any more questions? So I hope itong a dozen people attending here, so si Maria Justa may experience na, certified siya first aider, no? Walang problema. Okay. So that new CPR methods, which is simpler, chest compression only, I don't see why everybody should not learn how to do that. Huh? Okay. Huh? Okay. Okay. So if there are no more questions, it's we call it a day. So next topic, next week, we will be talking about breast muna. Back to breast, no? When ang topic will be probably, when do you say that you have a breast mass? Simple topic lang. No? When do you say that you have a breast mass? No? Okay. Okay.
Okay.
There are no more questions. We'll call it a day. Thank you for your attention. Thank you for attending. Okay. So we'll see each other next week.
Thank you,
Bye.
Doc.
Thank you also, Doc. Thank you very
Thank
much.
you.
Bye-bye.
Thank you, Doc.
Bye.
Happy weekend.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
Sige po.
Ingat po.